Hey, welcome back. My name's Jason Jolson, and we're going to jump into this. This is going to talk about the EMS systematic approach to all calls. It's the step-by-step process that we take, and it's important to understand the systematic approach, especially for running calls and if we're doing exams that are coming up. So we understand where we are at in the call and what we need to do next, and this will make a big difference. Okay, so let's jump into it. So this is the EMS systematic approach to training. How do we go step by step and get through this? Anyways, so first of all, what we're going to go through is we're going to talk about call preparation. We're probably not going to dive really too deep into that, but that's just being ready for the call. Where you come into your station, and you start at your station, you go through your truck, make sure everything's ready to go, make sure you have a stretcher in the back, because I've known people who've actually forgot their stretcher. They didn't bother to look, or you don't want to leave your 12 lead behind your monitor, so you want to make sure you have everything ready to go. Again, we're going to talk about dispatch. What can we get from dispatch? We're going to go through scene size up. We'll also talk about the initial assessment, and then the approach as we get towards the patient, and then we're going to talk about treatment plan, right? And then we're also going to talk about a bit about patient movement. So the first thing how the call starts out with is you get some dispatch information. Down below there, we have that you and your partner are being dispatched to a 17-year-old male who crashed on his mountain bike and he's unresponsive. And right away, part of the thing about dispatch is that information is, what do we get from dispatch information? Before we even get near the call, what can we get from that? So first of all, I know I'm being dispatched to an unresponsive patient. They're in a mountain bike, so obviously this is a trauma call, and right away I'm thinking that I'm going to need to take SMR, right? So we're going to look at some spinal motion restriction. Again, through this we can think about, before we even get there, talk to our partners about whether we got hazards, what kind of BSI do we need to put on, what type of safety precautions. If this patient's been riding a mountain bike, maybe they're on the edge of the bottom of a cliff, maybe we're going to need a fire department to come in, maybe need some help with rope rescue. And they are riding a mountain bike. Were they alone? Did they have any more people with them? That's kind of the information we can get from our dispatch information. And then we also can get some ideas that we might need more resources with this. And the mechanism of injury, we know this person was on a mountain bike and now they're unresponsive. So they must have done something pretty bad to crash their bike to be unresponsive. The biggest thing we got to remember is that dispatch tries the best they can do for the information they get. Basically, it's that telephone game. Somebody tells you something and you just keep relaying it to one another. They do the best they can. They're going to get the chief complaint. They're going to try to get some hazards if there's anything that you need to be aware of. They might stage you in case you're going to some violent call. And again, just how they code them are like Alpha, Bravo, Charlie calls and Deltas and Echoes. So you know that the higher level of call, whether it's an Alpha or whether it's an Echo, you kind of know where you're responding to. If it's an Echo, you know you're probably, the patient's most likely going to be in cardiac arrest. But again, you already have that hint what's going on. So if you're ever doing a scenario or you're doing your case study exam and they got parts, as soon as they tell you that you're responding for a 09 echo, we all know that's a cardiac arrest. Or if it's a delta fall, we know it's probably from a high level, and the person is, when they're phoning in, they have quite a high chance of injury. So the next thing we're going to jump into here in the next one is the scene size up and walk through that section.